Hello guys, today's topic is the female reproductive system part 2. In this video I am going to explain about internal female genitalia in details. Female external genitalia I have discussed in previous video. Internal female genitalia are located inside pelvic cavity. They include mainly four organs: vagina, uterus, pair of ovaries and pair of fallopian tubes, also known as uterine tubes. Now we'll see each structure of each organ in details. First organ is vagina. Vagina is the outermost female sex organ. It is in the form of canal extending from uterus to vulva. It is located posterior to urinary bladder and urethra and anterior to rectum. Upper end of vagina is attached to cervix of uterus. This structure forms a pouch known as vaginal fornix. Vaginal orifice may be partly covered by hymen. Functions of vagina: it serves three purposes. It facilitates menstruation, it is an entrance for penis during sexual intercourse, and it is a pathway for childbirth. Second organ is uterus, commonly known as womb. It is a hollow muscular organ located deep within pelvic cavity. Normal position of uterus is antevirgin anteflexion. The endometrial lining of uterus proliferates each month in preparation for embryo implantation. If fertilization occurs, uterus acts as a house for growing fetus and its placenta. If fertilization does not occur, endometrial lining shades during menstruation. Uterus is divided into three parts: body, isthmus, and cervix. Now, body of uterus. It is also known as corpus. Body is the main part of uterus. It is connected to fallopian tubes via uterine horns. Body has a base known as fundus and an internal chamber known as uterine cavity. Body has a lining of three layers. Endometrium is the innermost layer, myometrium is the middle layer, and perimetrium is the third layer. Now, isthmus. Second part of uterus is a constricted part located between body and cervix, known as isthmus. Cervix, the third part, the inferior most part of uterus, is cervix. It consists of two parts: supravaginal part and a vaginal part. Cervix has two openings known as internal os and external os, and also has a canal known as cervical canal. Now, functions of uterus: implantation and nourishment of fertilized ovum, that is gestation. It helps in pushing out of baby during birth through muscular contraction known as labor, and menstruation. These are the main functions of uterus. Third part is ovary. There are two in number. Ovaries are bilateral organs and equivalent to male testes. These are located in ovarian fossa of true pelvis, adjacent to uterus and below fallopian tubes. Ovaries are attached to uterus by ovarian ligament and mesovarium. Each ovary has four surfaces: anterior, posterior, medial, and lateral surface, and two poles, superior and inferior. Functions of ovaries: ovary releases egg for fertilization in each month. Also, it acts as an endocrine gland and secretes female sex hormones, that is estrogen and progesterone, necessary for fertility, sexual maturation of female, and menses. Fourth organ in internal female genitalia is fallopian tubes. They are also in pairs. These are also known as uterine tubes. These are bilateral muscular tubes extends from uterine horn to the superior poles of ovary. These are intraperitoneal organs covered completely by uterine ligament, which is known as mesosalpinx. It consists of four main parts: infundibulum, ampulla, isthmus, and uterine part. First part is infundibulum. It is a distal part of uterine tube which opens into peritoneal cavity. It contains finger-like projection known as fimbriae, which extends over medial surface of ovary. Second part is ampulla. It is the longest and widest part of tube. It is a common site for fertilization. Third is isthmus. It is the narrowest part of uterine tube. Fourth part is intramural part or the uterine part. It communicates directly with uterine cavity. Now functions of fallopian tubes. Fallopian tubes has main functions like the egg released by ovary is guided by fimbriae into the opening of tube. The hair-like projections of the tube, known as cilia, propel the egg downward to the uterus. The ampulla part of the fallopian tube is the usual site of fertilization. This is all about the internal female genitalia. Thanks for watching. If you like the information, please like and subscribe our channel. Thank you.